Good morning, you guys, and happy Thursday. My name is Ijama. I am a family medicine attending, and I just got to work. It's 7 o'clock, and my first patient is already getting ready. The 7 o'clock, so I am getting ready to head in. We are finally done with construction, so we now have like a new staff parking lot where we can like enter into the clinic like through the back, which I love. So I'm getting ready to head in and get myself situated. All right, so this is our current situation. We have a full schedule today, 23 patients. I'm getting ready to go see this person. I don't know why this is a red dot. This person is about to be getting ready. Let's have a great day. We're gonna have a good day. I'm feeling it. And let's go team. Okay, so I am 1, 2, 3, 4, 5, 6, 7 patients in. 2 are waiting. Kind of out of order at this point because people came late, but just finished up seeing a gentleman who was here for routine follow-up, blood pressure, diabetes, reviewed some labs, had elevated prostate labs, but then when we rechecked them, things were better. It was back to normal. He already has an appointment with urology though. And then we were supposed to change his blood pressure medicine, but he never got it in the mail. So I'm just finishing up with his note, and then I'm gonna move on to the next person, which is somebody who came late, but looked like they were pretty sick based on when I was looking in the chart. So like just not feeling good, nausea, vomiting. So I said, okay, I'll see them late. So yeah. So yes, this person is the one I just finished seeing who was on time, and then these 2 came late. I'm about to see this person 30 minutes late, and then I'll see this person. Okay, I just realized with the camera what was going on with the lighting. Okay, so I just finished with the morning, busy morning, especially after those 2 late patients. One wasn't that big of a deal, but it just threw me off. The other one was like a 30-minute visit with a host of different things. And after that, I was done for. Everybody after that, I saw like an hour after their scheduled time. Some even worse. But I just finished with the last one. I still have notes to do because I couldn't keep up with my notes towards the end. I'm gonna go use the bathroom. I've been holding my bladder all morning, trying to get through the patients. And so I'm gonna use the bathroom, go get my food to eat lunch. And then once I get to a little bit of a better place, I'm gonna catch you guys up. I'll talk about some of the cases I saw this morning and get ready for the afternoon. At least, like I always say, we're front loaded in the morning. So once I finish in the morning, I can just breathe, get myself together. And the afternoons are usually just not as bad. They can be bad, but they're usually all right. So finished eating, finished my notes, just in time for the afternoon to start. It's almost 1 o'clock. So I'm probably just gonna wait till the end of clinic to kind of go over the types of patients that I saw so I can get started. But I saw 13 patients this morning, and I already have 2 patients this afternoon here. One is already in the room. It's 12:55 right now. The 1 o'clock is already in the room. And I don't want to start getting behind again, so I'm just gonna get started seeing patients, and I'll circle back to telling you guys what's up. But yeah, very busy morning. And I'm tired. All right, it's 2:50. Just finished seeing my last patient. We are done for the day. And on my notes, let me see how many people. I ended up seeing 6 patients this afternoon. So that wasn't too bad, but let's go over some of the cases that I saw. Okay, so in no particular order, I saw Patient for diabetes follow-up who's doing fine. Weight has come down with Victoza, but plateaued and lacking motivation to get more active. We talked about depression and stressors at home. A patient for chronic pain who I've been seeing for a long time, has this spinal stenosis compressing in the spinal cord, went and had back surgery, did not change anything, still having pain, and unfortunately now is doing chronic narcotics, one of the like very few that I have on chronic narcotics. But nice guy, still doing physical therapy, still trying to get better, and has another MRI coming up. Nausea, vomiting, probably after GI illness. Blood pressure follow-up, and ingrown toenail, referred to podiatry. A new patient, well, not new, but new to me. Uncontrolled diabetes, chronic pain, depression, insomnia. That was a prolonged visit. Regular diabetes follow-up, annual physical, back pain, wanting different medicine than what was prescribed, but also has CKD, so can't use NSAIDs. A painful, like, cluster of skin tags or something growing underneath the armpit. That's something I've never seen before. It was very strange. With a, like, induration underneath that was tender but not draining anything. I sent that for ultrasound and to dermatology. Patient following up for diarrhea, doing better. Patient following up after ear infection, doing better after antibiotics. Hemorrhoids. New patient with anxiety and palpitations, getting Holter EKG, labs, and follow-up, medication refill, pap smear, diabetes follow-up, doing well. So yeah, that's the gist. That's what I saw today. It's a pretty decent variety. Nothing super acute, but just, you know, interesting stuff. Derm, gynecology, musculoskeletal, psychiatric. Yeah. So I'm done for the day. I wasn't able to touch my in basket, which currently has 57 items in it, but tomorrow is Friday, which means I have procedure clinic. Even though procedure clinic is full tomorrow, it's mostly just injections, so it'll be quick. And I'm going to be able to hopefully get caught up on all of the in-basket stuff tomorrow so that I can go home. I'm going to stop at the gym and go home, see my child. We got 2 more days of having a nanny, and then that's it. Nnamdi is starting daycare next week, which is just insane. It's going to be me and Chris doing our thing. We can update on that later. Okay, just got in the car. Just as I was leaving, they almost got me because one of my patients was here for a nurse visit to get a B12 injection, one of her in her weekly series, and she started feeling short of breath like 30 minutes later. So they were telling me about it, and I was like, at first my medical assistant, she couldn't remember who the patient was. And then she kind of described the patient. And I was like, oh, okay, yes. I know who that is. You know, this is somebody that has chronic shortness of breath and stuff. So I was like, okay, yeah, this. I told her what I wanted her to do and didn't need to see the patient. And I'm about to head out. Cause once you have to see the patient, it turns into like a stat visit. You have to like document. And it's after 3 o'clock. I'm gonna go, I'm gonna stop at CVS. I mentioned before that it was our last week with our nanny. And we're transitioning Nnamdi to daycare. So I printed out like a picture collage for her. And I want to put it in a frame. Just as like a very simple like goodbye present. I mean, she's still gonna be like coming to help us here and there, but just something nice for her. So I need to go to CVS to pick that up, and then I'm gonna go to the gym. All right, I just finished changing my clothes in the bathroom. About to go work out. Probably do like a little 30 minutes. I like to warm up on the Stairmaster, and then usually I do a YouTube video of a workout. Today I might just play some music and do my thing. Before this I went to CVS. I just didn't vlog because my sister called me. I was on the phone that I went to get the picture for my nanny. But yeah, let's get this work. Yeah, you have my phone. This is your job. To unload my lunch. Finished eating. Just chilling for a little bit, and then we're gonna go and shower.
X is for X-ray.
Mm-hmm. Mm-hmm. Still playing with this thing. I had so much fun with it.
Ball.
Ball. Yeah. All right, so Nnamdi is down, which means I can use my regular camera without World War III. I'm getting ready to make my dinner. Chris came back earlier, but then he went out to go to the gym while I was putting Nnamdi down. And then I'm about to eat. I have craving for Indomie, so I'm gonna eat Indomie, add spinach, make egg and plantain, mix it all together, and that is gonna be dinner for me while I watch Suits and wait for my man to come home. We are, like I said, transitioning to next week being daycare, although it's supposed to be a hard freeze here in Houston. So I don't really know if the week is gonna go as planned, but I took the whole week off next week for Nnamdi's transition, and we are going to start dividing up the week for baby duties. So we've always had our nanny who took care of the feeding and cleaning up the kitchen while I always did the bathing and putting him down. So now we're going to be alternating nights. So it'll be your Wednesday or night, then you do the bathing, you do the feeding and the bathing and putting to sleep, and then so the other person can like go to the gym, like how Chris went out. So that's our plan, except I'm really good at putting him down because I can put him down drowsy and leave him, but Chris is like not as well versed in that. So I'm happy to always put him down because putting him down is very easy. I like to say our prayers together and stuff, so I don't have any issue with that. But the main thing is like the bathing and getting him dressed and ready for the night and feeding him. That whole process is like an hour, maybe like 45 minutes to an hour. So yeah, we're gonna be splitting it up. Anywho's, time for me to make my dinner and get ready to wind down. Also, we got a new dining table and chairs. We wanted to upgrade from what we had before, which was purchased to be short-term use anyway. So this one is from Povazon. It's really nice, like a matte centered stone. And these are leather chairs. Yes, I'm loving it. We just have to get a new rug. We gave our old table and rug to my sister, and we need to replace the rug. It's part of my to-do list for my week off. And also we have a stain, not a stain, but a coffee or a cup stain or something over here that we need to address. All right, so this is what we're dealing with. We got our Indomie, egg, plantain, with spinach, and just bon appetit. It's supposed to be yummy, yummy, yummy.
But before that, I gave my word to Oscar Reyes. I'm sorry, but I can't back out now.
Okay. So you're just gonna live your life keeping secrets again?
This isn't like that.
How is it not like that? We're keeping this from Harvey.
And Harvey kept things from Jessica.
Look at how that turned out.
All right, Chris is back from the gym. I just finished making his food, okra soup and okra soup and fufu. And I'm about to go get in the shower so I can kind of wind down. And it's after 9, it's 9:20 right now. I'm gonna shower, hopefully by the time he eats, chill, shower. Hopefully we're in bed by 11. That would be ideal. But yeah. I don't know if you hear him upstairs. He's talking on the phone. We had to do more baby proofing because my son has sticky fingers and presses on these burners. We already have all these places all locked up. And then the oven is locked up as well. We just need we got these. These are like supposed to be for the doors, and I think we said we'll try and put them here, but we haven't done that yet. Yeah, toddler life. All right, getting ready for bed, out the shower now. I just wanted to show what I've been using for skincare lately. I've been using the Dr. Idris line. No, hold on. Yes, Dr. Idris. This is like a 3-part major fade line. She's a dermatologist. He or she, I think it's a she since it's lavender, but I don't actually know who this is. I was recommended by my sister. So I have the mask, which I put on twice a week. It's a chemical exfoliant. Leave that on for like 10-15 minutes and then rinse it off. And then I use the serum, and then I use the vitamin C gel moisturizer. So far, I feel like it's been pretty good. I've been using it for about a month. I got it for myself around Christmas. So it's been about a month that I've been enjoying that. So anyways, I'm about to go to bed. I'm gonna, I think, end off the video here. I hope you guys enjoyed watching a day in the life. I have said it before, but I really do enjoy my work. It's quite fulfilling. There's a lot of places to push myself and challenge myself. There are times to relax and take it easy. You know, I can take time off and not worry. You know, I like it. So, another night, and we are back at it again tomorrow. Hope you guys enjoyed watching the video. See you guys in my previous videos and in my next videos. Please give me a thumbs up and leave me a comment if you feel moved to. I always like reading you guys' comments because with YouTube, it's like you don't really know people. Like, it's not like Instagram or something where you can like look and see people's pictures. Well, on YouTube, you can't really tell, but like sometimes when I read the comments, I feel a little bit more connected to the audience, and so I appreciate that. Anyways, good night.